Andrew Mim, KGFW. What is an alternative process for employment claims if an employer cannot be reached for verification? Taylor, did we get an answer back from Commissioner Albin on that? Excuse me?
No,
have not been able to get a hold of Commissioner Albin yet, so Andrew, we will follow up with you. Taylor will take that as a to-do to follow up with you specifically with regard to what does the Department of Labor do when they can't get a hold of an employer to verify employment. We also had a question from Charlie Brogan at KFOR. Is the governor planning on issuing guidance for Memorial Day events? Yes, we will be issuing some guidance, but again, we just talked about that DHM is going to be extended to May 31st in the public health districts I already talked about. The 10-person rule is extended. That means that as you're thinking about your Memorial Day celebrations, 10 people or less. Again, just like we asked for Easter, we said the same thing for Ramadan. Celebrate with the people in your household, right? Really try to keep that limited, but no more than 10 people. So 10 people or less for your Memorial Day celebrations. So we're reminding people as we get closer to Memorial Day. Do we have any other questions that were texted in, Taylor?
Martha Sauter wants to know whether we can prioritize nursing homes, first responders, or people in hard-hit communities with the new testing.
So the question from Martha was, will we be prioritizing nursing homes? What else? First responders and hard-hit communities. So generally what we're going to be doing is prioritizing the healthcare workers, first responders as part of that overall, and we will be looking at, as we stand that up, where else we might be able to do that, what else we might be able to do to prioritize where we're going to go with that testing. But this is why the assessment's so important. If people fill out the assessment, that gives us a bigger view or a broader view of what's going on in the state. That helps us make decisions about where we're going to deploy that testing. So please, go to testnebraska.com, less than a 5-minute assessment. That will help us out tremendously as we look at that aggregate data about where we should be deploying our resources.
She also asked, are we, under Test Nebraska, is the state only paying for the tests used?
So Martha also asks, is the state only paying for the tests used? Actually, we're paying the entire program well, not up front, but we're paying $27 million for all 540,000 tests. So we will be using all 540,000 tests.
Grant Schulte says, why do we not include Lancaster County with the regions that are getting more changes? And how did you decide which regions to include in the group that you had asked? So with Grant Schulte of the AP asked, why was not Lancaster County included in the DHMs we just announced? Lancaster County's DHM does not expire till May 6th. They were on a different time frame than Douglas County, and we will work with Pat Lopez and Mayor Gaylor Baird about their DHM and what we do with that going forward. So expect an announcement on that next week sometime probably as we work through it with them. And then with regard to those other public health districts we announced, we had worked with them. You'll notice that they're the ones that are probably more lightly impacted than other parts of the state. This is consistent with what we said. We're going to look at this regionally and try to tailor it to the region of the state. These public health districts have been more lightly impacted, and that's why they were included with regard to our announcement. Many of them had DHMs that were expiring either May 6th or May 11th, and so we are putting them together with the one that is going together with Douglas County that will begin May 4th and run through May 31st. But it was in conjunction and working with those public health departments directly making that determination. Those are all the questions I have.
Great. So I know we gave a lot of information about those new DHMs, so I suspect there will be some questions here. And Paul, I'm sure you got a question. Should we start with you since you're closest to the front here? No? You're going to let somebody else do it? Okay. All right. Well, questions. Yeah, Lee.
So in the past few days, you talked about how the questionnaire was kind of give you a direction as to where you would know to relieve or pick up some of these DHMs or take away restrictions. Today, you announced a wide variety of changes. What was the input that gave you the reason to do this? Because I was under the impression that you were going to use the data that you were getting from the questionnaires to kind of direct where the changes were going to happen.
So when we get that the guidance from the questionnaires or get that data from the questionnaires, that will help inform what we're going to do with regard to that going forward. However, we're not going to make that the limiting factor in how we make decisions. And again, primarily all this is focused around the healthcare system. If we are not overwhelming a healthcare system, we're winning, right? That's our goal. So we look at things such as hospital bed utilization, ICU bed utilization, and ventilator utilization. So that's the primary director. But as we gather this data, we will use that as part of another source of data that we will use to be able to make decisions about where we deploy testing resources and where we might deploy PPE and things like that. We'll get a broader view of what's going on from Nebraskans themselves to be able to see what's going on in the state. But we can't wait for that data, right? Again, we want to make sure we're moving forward with the data we have. So that data will help inform us in the future, but we're using the data we have right now to make the decisions with regard to the DHMs that were expiring April 30th.
Grant Schulte has a follow-up question.
Does Grant get to jump in line like that? Is that fair?
Well, it's an important question.
Oh, it's an important question. Okay.
In areas where restaurants can start to reopen, will they still be able to offer takeout alcohol and sell non-food products?
So the question from Grant Schulte is, in areas where restaurants are going to be allowed to be able to operate dine-in, will they still be allowed to do takeout alcohol and sell other non-traditional type products? And the answer is yes. That's a part of our emergency proclamation or part of the emergency, so that will still be allowed to go forward. No change in that. Fred.
Is answering these contact tracing questions voluntary, or is there a penalty for not answering them? And what would you say to people that are concerned about the government coming around and asking them what they're doing?
Right, so Fred asks, hey, so you find somebody who's got that positive identification for coronavirus, right? They've been tested, they're positive. Then we do the contact tracing about all the people that they've been in contact with. Is answering those questions voluntary? Absolutely, it's voluntary. There's no penalty for not answering them. But the person's own self-interest is on the line here, because I personally would want to know if somebody I had been in contact with in the last 2 weeks had tested positive for coronavirus. Because that's how I know I need to be monitoring my health care to see if I start developing symptoms, to see whether I might have coronavirus. So it's a completely voluntary program. Absolutely, there's no penalty for refusing to answer questions, but it's in the person's own best interest to answer those questions, because then they know that they should be quarantining and staying away from their loved ones so they don't infect somebody else.
And what kind of questions will they be asked?
The question is, what kind of questions will we ask? Danette, you were just part of the training today. Can you come up and give us some answer about no, come up to the microphone here, because people can't hear you if you're back there. Why don't you talk a little about what that training involves?
So the good question that you asked, a lot of the questions have to do with demographics, but it also has to do with the kind of symptoms that you may be experiencing or the lack thereof. The way in which the training is being done, it's more conversational. Even though it's a template and it's kind of checking off the box and making sure that we're getting the most important information, it's more conversational than it is anything. So it's asking you about your family. It's asking you about where you worked, when was the last time you worked, when was the last time you saw a healthcare provider, and did you see the healthcare provider about COVID-19? It's those kinds of questions, but it's more conversational that allows that person who's on the other line to be very comfortable in the conversation. I would say to you, it doesn't have a feel of being government. It has a feel of, we really care about you, and we want to take this information to direct you in the right place.
And Danette, maybe also before you leave the podium, you just talk a little bit about some of our bilingual staff that we're working on as well.
Yes. So there are going to be approximately 25 of our current bilingual staff that will be on the phone actually having a lot of these conversations. We recognize our communities of color when giving out information sometimes can be frightening. And so we want to make sure that the information that's shared is relatable, that the questions that are being asked are pertinent questions, but it's relatable and it gets to a better understanding of their health care. And so there will be a lot of bilingual staff from staff who are Hispanic, Sudanese, those who are thinking the last Somalian, yes. So we will have a variety of languages that are going to be covered over the phone.
And it's all going to be by telephone?
It will be by telephone, yes. Everything will be remote at this time. But the most important thing is that the questions come off like a conversation. and it's entered right into our system. And so we have prepared our staff that we recognize that COVID-19 is really hitting the minority or communities of color very hard. And so we know that we're going to be using interpreters, and we're going to be using our bilingual staff to make sure that we can have meaningful conversations with those persons on the other line.
Thank you, Nanette. Other questions? Yeah, Andrew.
I can understand why you want to extend some of the, the deadlines on here, but why loosen things up when we still haven't hit the peak yet?
So Andrew's question was, gee, if you look at some of the models, it says you haven't hit the peak yet, why are you loosening things up now? And it gets back to, again, what Dr. Ali Khan said on NET several weeks ago with regard to these models. They're not predictive. They are models to help you think about what is going on in the state. What we can look at directly, though, real hard data, not predictions, is we can look at what's happening in the healthcare system. And so we're going to use those kind of tools with regard to, what are our hospital capacity at right now with regard to ventilators and ICU rooms and beds. So, for example, if you look at Omaha from the data from yesterday, I think we had 389 ventilators. 96 of them were in use, 21 for COVID patients. So you can see that 75% capacity in ventilators. And that's typically true statewide. And we've got a dashboard out there on our DHHS website that shows what is our capacity for hospital beds and ICU beds and ventilators so that people can see that statewide, that we've got that capacity here in the state. So that's what we're really tracking. And then we look at things like the testing data to say, hey, if someplace like Hall County or Dawson County where we've got high percentage of people testing positive, 30, 40%, we know that there are people that are going to be coming into the hospitals there, and so we get ready for that. And so that's what Dr. Antone does when he works with the public health directors and the hospital chief medical officers, is try to prepare them for that so they can maybe move patients out to make room for the patients we're expecting to come in. And that's how we're kind of managing that on a regional basis. So the DHMs that have been, where we've lightened up some of the restrictions are in areas where we're not seeing those high percentage of people testing positive. So we're really kind of looking at, how many cases are coming in, what kind of percentage are coming in, that sort of thing, and then what's happening to the hospital system to make these determinations to be able to, again, tailor it for the part of the state so it's going to be appropriate. And again, what I remind everybody is the 10-person rule is still in effect through the end of May. So May 31st, we are sticking with that 10-person rule. So again, talking about Charlie Brogan's question about Memorial Day, plan for 10 people or less, and preferably just your household doing that celebration.
But aren't you worried about creating a surge in those communities that might not be experiencing the problems right now?
So Andrew's question is, are you concerned about creating a surge in those communities that have not been heavily impacted? I'm going to pick on southeast Nebraska because I think Richardson and Pawnee still have no cases reported as of last night, 6 p.m. So are you concerned about creating it there? And actually, we will monitor that. But again, we want to tailor this to each region. And if we don't have significant spread of virus in those communities, the things we're doing are really very incremental to be able to loosen up some of these restrictions and appropriate for that district. Whereas in other districts, as I mentioned with Hall County or Dawson County, we're not making those changes. Yeah.
So is that, as it for like the churches and restaurants, for the 10-person limit for the exclusions for that, will it be tailored then to each health district?
So the rules I announced that with regard to the 10-person rule being extended through May 31st applies to each one of those health districts that I laid out, that the things with regard to, say, how beauty salons and barbershops can open up with the masks and everything, that will apply in those. The restaurants using 50% of their capacity, that applies in those 10 public health districts I laid out. The daycare going to 15 kids, that applies in those. So the only things that are statewide at this point are the elective surgery, which we announced earlier this week, and then the ability of church services, weddings and funerals being able to go forward starting May 4th.
So even in the areas that have the highest, that have higher impacts, you're gonna allow church services.
Yeah, so the question is, so Governor, what you're telling me then is we're still going to allow church services in those areas where we do have higher impact, and the answer is yes. And the reason for that is that one of the ways that we want to reach out, and Danette Smith was talking about this, reach out to some of those communities where English is not their first language. We feel like we can do a better job communicating to them through the religious organizations and getting that message out to them in a way that maybe is less threatening because it's not government, and then also because it could be in their language, is from people that they trust. So we're going to be working with those faith leaders to get that message out about the social distancing. And this actually relates back to one of the things Deborah Burke said on our call with the vice president that we had earlier today, is that they've been looking at some of these communities where we have food processing plants and what the cause of the virus breaking out there is. And while the food processing plants are taking steps to be able to do the social distancing and have done a lot of great work, in fact, Dr. Lawler and Shelley Sweetholm have said that they're very impressed by the work the food processors are doing, the emphasis now needs to really shift to the home. And so this is a way for us to be able to shift that emphasis on the home, and especially where you have more communal type living, to be able to get that message about social distancing out to those communities where English is not their first language. And so that really is one of the reasons why we made the determination to allow those church services to go statewide as opposed to just in those selected DHMs, is that we really want to leverage those religious organizations to be able to get that message out to those communities about the importance of social distancing. So Paul's question is, hey, the number of cases keep going up, but by the way, we should expect that because we're doing more testing. So as we test more, we expect to get more cases test positive, right? That's just a measure of the numbers. So that's why we look a lot at the percent testing positive. So that makes the difference between some place like Lincoln, where they're testing at about a 4% positivity rate, versus, say, Dawson County, which is at a 40% positive testing, okay? So the difference is there, not just the number of cases, but what percent are testing positive. So we expect the number of cases to go up, right? And then Paul said, well, but what about, we get lots of emails saying, people are saying, hey, you gotta loosen things up, you're killing the economy and that sort of thing, and how much does that play into our role? And again, what I'm focused on is the healthcare system. I look at where are we with regard to hospital beds, ICU beds, ventilators, and looking to see, are we overwhelming the hospital system anywhere? And what can we do about that? So again, with our elective surgeries, Hall County doesn't, St. Francis CHI does not fit the category of being able to do elective surgery, right? Nobody's going to be surprised by that. In Lexington, we know we're getting prepared for more people coming in, and we've done some transports to be able to make sure we've got the ability to handle it. Lexington's not going to be doing elective surgeries. So again, what we want to do is we really focus on the healthcare system. And if you look at, for example, in the Omaha area, the stats I already gave you, we've got lots of capacity right now, so you can't say we're overwhelming the healthcare system. It's appropriate to start loosening up some of these restrictions. Again, small steps, right? We're not getting rid of the 10-person rule. We're still at the 10-person rule, but we are taking some small steps with regard to some of the other things like the dining and some of the other businesses that we had previously closed. And not all those either, right? Like we're still saying there's a bunch of businesses like bars that can't still have dine-in. You can't, the gentlemen's clubs, bottle clubs, indoor theaters, movie theaters, all those are still closed through May 31st.
So in a state where we have all these authorities at the medical center on vaccines and these kinds of epidemics, why are we turning to a public-private partnership to do this extra testing?
So Paul's question is, with all the authorities and resources we have here in the state of Nebraska, why are we turning to a public-private partnership? And it gets back to is we're exploring all channels to be able to expand our testing. This is the one that we announced this week where we could hire a company to be able to help set up a lab for the state that we will be overseeing and running. It won't be their people doing it. They're going to help us get the machines and get set up and all that sort of thing. But we'll be running the lab. It's a way to expand our capacity. But it's not the only way we're looking to expand capacity. So as I mentioned earlier this week, the federal government gave us a list of all the machines that could potentially be used for doing coronavirus testing. And so our teams right now are following up on those leads, so to speak, to see, what can we do? What's the obstacle? Are there obstacles? Like, are they shorter reagents too? Have they just not been asked to do testing? There's some things like that we're pursuing multiple channels to expand testing. This is just the one that we announced this week that will allow us to do more, but we're going to try and find other ways to expand testing too.
Some people question, if you're asking people to voluntarily assess themselves on this website, couldn't you be more strategic with these tests and focus on the areas where, there is a hot spot. Now, you're pretty well dependent right now on, who gets on the computer and.
So with regard to Test Nebraska, you're kind of dependent upon who actually signs up. And the question is, couldn't you be more strategic about hotspots? And actually, we are already deploying resources to hotspots, right? So we're already doing the things with regard to if you have a spot around, Dawson County or whatever, deploying National Guard there and getting people tested. So we are doing that too. But this is a way for us to be able to get a bigger comprehensive view of what's going around the state and not just places where we can test by having people voluntarily tell us that they're interested in testing and taking that assessment so we kind of have an idea of, what is going on around the state with regard to what kind of symptoms people are reporting and that sort of thing. And as you know, some people may have symptoms that are related to coronavirus, or it could be allergies or something else, or they could be asymptomatic, but we want to know what kind of folks are interested in getting that testing to help us deploy those resources, and it'll give us aggregate data, will make a difference in how we do that.
I know you got a question about hydrochloroquine last night on your call-in show, but I guess now there's a report out that one of the principals in Test Nebraska is on a board of directors of a company that makes hydrochloroquine. Did that have anything to do with that? What's your reaction?
So the question is, one of the board members is a principal, one of the board members of one of the companies that is helping us set up our testing lab is on the board of a company that also produces hydrochloroquine. Is that what you're saying? And so did that have anything to do with it? And the answer is no. So our Test Nebraska program doesn't have anything to do with hydrochloroquine. That would be, what we do with Test Nebraska is we test people. If we find out they're positive, we ask them to isolate, but then they need to go talk to their healthcare provider, who will then determine what their treatment is. The state isn't involved in what they're doing with regard to their treatment.
Who asked that question be put on and why?
Hydrochloroquine is kind of one of those things that has been put out there as kind of a common treatment. So if that was something that you were allergic to, we would want to make sure that that was flagged so that you could tell your healthcare provider in case they were recommending that. But, that's just part of one of the questions out there. The state's not going to get involved with regard to what your healthcare provider actually does as far as your treatment.
But was that a question the state asked to be put on there? Or was that
No,
something the company-
it was part of what the company put together as part of the overall questions. Again, based upon their experience coming from Utah.
Is this relaxation consistent with the plan that you came up with originally with UNMC? And did you consult with the public health districts?
Yeah, so Fred asked, is this plan consistent with what the plan we came up with working with UNMC, and do we consult the public health districts? And yeah, so what we talked about was, again, not overwhelming the healthcare system, that we put these restrictions in place and start releasing them a little bit at a time, right? So the original plan called for putting these NPIs in for a period of 6 to 8 weeks, and then releasing them gradually over time, and that's what this does. And we did talk to the public health districts about the plan, got their feedback, made some changes based upon that feedback. Just specifically talking about like some of the guidance we want to put in the restaurants. Talking with Dr. Lawler about wearing masks for all staff, whether it's a server, the kitchen staff, the cashier, that kind of thing. So taking that feedback in to make changes to what the guidance document's going to be.
We have time for 2 last questions.
2 more questions. Andrew.
A couple of weeks ago, you kind of gave a grim forecast of what we were going to be experiencing. Now that we're almost 2/3 of the way through your proclamation, where are we at, do you think? Is it better than what you thought, or is it what you thought?
So the question from Andrew is, hey, where are we now? We're 2/3 of the way, a little bit more through the 21 days to stay home and stay healthy. Are we where you thought you'd be? Is it better or is it worse? I would say that in general, our plan is working, right? We have not overwhelmed the healthcare system, so we're winning. Certainly, we've got areas of hotspots that we need to manage around densely populated folks, whether it's at home or in their place of work, that we need to manage through that. If you actually pull those out and look at the state as a whole, Nebraska is doing very well. So we've got, communities that we have to work on, but in general, Nebraska is doing really, really well with regard to the things we have put in place have worked. We've slowed the spread of virus here in the state. That's just completely obvious. Yeah, Paul.
I asked a question yesterday about the contract with Test Nebraska that will allow the sharing or selling of the aggregate data.
Yeah, Taylor, did you get an answer back on the sharing or selling of aggregate data?
I can ask about it, I didn't ask that.
Okay, we need to follow up on that question. Sorry, Paul, we didn't get the answer, sorry.
Another question, I know you've spent a lot of money on PPE. Has it actually gotten out to the health districts? I mean, I'm getting some complaints about that.
The question has, we spent a lot of money on PPE, is that getting out to public health districts? Absolutely, we send out shipments a couple of times a week. So I don't have the numbers off the top of my head. We can get that data for you. Maybe Taylor, that's one of the things we could update on Monday is just what we've done on PPE and how much has been distributed. So Taylor back there somewhere? Okay, got it, Taylor? Great, thanks. So we'll pick that, we'll get that out as part of the, we'll update those numbers on Monday as part of our overall, what have we done on PPE. And if there are specific people who are saying they got problems, they really should contact their public health department, because we send we send the PPE to the public health department, and they're the ones who distribute it out to the folks who need it. So, well, again, folks, thank you very much. Appreciate everybody coming here this afternoon. Remember, Monday, 12:15, not 2 o'clock Central Time, is when we'll do this briefing. Again, it'll be relatively abbreviated because I've got a Pardons Board hearing starting at 1 o'clock. Thank you all very much, and I want to thank every Nebraskan who is working very hard to slow the spread of virus here in our state. Thank you so much, and have a great weekend.